the secretary to call the roll.
Ryan,
Here.
Parker, Arnett, Blackman, Blackwell, Blunt, Kaufman, DeBar, Fillingane, Frazier, Harkins, Hobson, Horn, McMahon, Parks, Polk, Tate, Wiggins.
Thank you. Dr. Blackmer is currently serving on the State Board of Optometry. She has been reappointed, and I've asked her to come sit and visit with us about the State Board of Optometry. So if you would, Dr. Blackmer, first of all, thank you for coming by. And would you tell us a bit about yourself and what your service on the board has been like so far?
It only took one press. I'm impressed. You told me it was going to take several presses on this to
Oh, and you got it to turn on the first time.
magic finger.
You're very talented. I've never been able to do that.
I'm Lori Blackmer. I'm an optometrist. I practice in Picayune. I've been in the same location for 33 years. I'm married to an optometrist. I have 2 adult children. Neither decided to go into optometry, which is kind of a disappointment. But I've been on, this is my beginning of the second term of my state board. Presently, I'm serving as chair. So I do hope I get reconfirmed today. But I also served on the school board for Picayune for 5 years previously. I do want to thank the legislature for helping out optometry this past few years. It's been a challenge for the board to get everything in line and such like that, but it was a great challenge to have, and it's beneficial to our residents that are underserved medically. And now we have better access for our residents for eye care, and I do appreciate that. And like I said, we've been pretty busy here the past couple of years, especially since we've got the new law passed with scope. So we've worked really hard at trying to get within the law all our optometrists that wish to be advanced procedures, licensed, tested, vetted, ensuring going forward that they are taking additional or content for education for these additional procedures that we're now capable of doing. So it's been a challenge, but it's quite an enjoyable and fulfilling challenge.
Well, thank you. And you referenced the increase in scope of practice for optometry. And as you know, the Board of Optometry is to regulate, of course, the practice of optometry generally, but that specifically. And those of us in the legislature who voted for that legislation, which I think is just about everybody, and of course, the citizens of the state are depending on the Board of Optometry to make sure that those performing this procedure are well trained and in fact are performing in accordance with medical standards. And, you know, at some point, people are going to get tired of hearing me say I don't understand anything about public health. Obviously, I don't know the ins and outs of what training you need. I don't know what metrics you would need to follow up to see what's happening in the real world, if there are good outcomes and bad outcomes. But all of us are relying on you and the board to do that. So I appreciate your mentioning that, and I would hope you would continue to do so. Are there other questions for Dr. Blackmer? Is there anything you think, anything you need to tell us?
No, like I said, it has been something when going from a board, going from one side being a practicing optometrist to actually being a member of a board, that public health is my main concern, is the health of the public. So we are going to, as a board, do the best we possibly can to ensure that our optometrists in the state are up to every medical standard possible, so that the public is protected.
Thank you. Dr. Parker indicates he wishes to make some comments, and who knows, when he finishes, he might even have a motion. Senator Parker.
Thank you, Mr. President. I just make a comment that I've known Dr. Blackmer for a long time. We trained on some laser procedures together and I found her to be very competent, and she's just been a great person for us to have on board for many years now. And my motion would be that we do advise and consent.
Is there further debate? If not, the motion is do advise and consent. All in favor say aye. Opposed, no. The ayes have it. Thank you. Thank you, Dr. Blackmer. We appreciate your stopping by to visit with us.
Thank you.
The next item on the agenda is Senate nomination 4, Patricia Robinson Nelson to the Mississippi Leadership Council on Aging. You have peer committee reports in front of you. I believe Senator Parker has a motion. Senator Parker moves we do advise and consent. Are there questions? Not, are you ready to vote? The motions we do advise and consent on Senate nomination number 4. All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. The next item is Senate nomination number 7, Chloe Ray Farmer to the Board of Barber Examiners. The peer committee report reflects that there is some question about Mr. Farmer's actual participation in the profession. I will say to the committee, we have overlooked such matters many times in the past. I've spoken with the senator who represents Mr. Farmer in the state Senate. She's indicated to me that she would like for us to confirm the nomination. Senator Parker. Senator Parker moves we do advise and consent. Is there debate? Are you ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. I want to say to the committee that I asked several members of the committee to look over a large number of these nominations. And I appreciate very much their doing that. They brought to us matters that needed to come to our attention. And appreciate the time they spent. As you all know, we've had some long hours of meetings and hearings over the past 4 years. The attendance of the committee has been very good. The patience of the committee has been long suffering. I appreciate it. I hope we all know a bit more about public health than we did 4 years ago. And if the good Lord's willing, I'll see you all next year. Senator Parker moves we rise and report. All in favor, aye. Opposed, no. The ayes have it.